Action Network's webinar on sport and mental health. The session is the 70th Mental Health for All webinar from the series that has been running since April 2020. My name is Anne Wintrow. I head up the Lululemon Center for Social Impact. My pronouns are she, her. I live in San Francisco, California, and I am so thrilled and honored to be moderating this conversation of incredible people today. We have just an amazing lineup of panelists. If you have any questions for them, please submit them in the Q&A tab and vote for your favorite submissions so we know which questions to get to first. These are passionate mental health advocates and sports enthusiasts from all around the world. So as you get settled into the session, please let us know which country and organization you're joining from in the chat. After our audience Q&A, which will come after our questions, we'll be hearing from the French Ministry of Health and Prevention to learn about the mental health plans for the Paris Olympics and Paralympics. So please be sure to stick around to the very end of the webinar. Now, before we get started, let's find out where our panelists are joining us from today. If I could ask each of these amazing panelists to share their name, where they're calling from, their organization, and perhaps also what sport they love to watch or play, that would be wonderful. And we'd also love to hear from all of you on that in the chat. Yeah, go ahead, Sofiane.
Hi, everyone. Good afternoon, good morning. I am Sofiane Kalfaoui. I am the head of the Improving Mental Wellbeing pillar at the Zurich Foundation, based in Zurich. And my favorite sport is running half marathon, short distances.
Thanks, Sophie, and hi, everyone. My name is Adam Burgess. I'm the Director of Programs at Beyond Sport. I'm based in London. We have London and New York offices. My favorite sport growing up was always soccer or football, but now I'm a bit older, so I probably play more golf than that.
Hi everyone, I'm Hailey van der Walt and I'm the Program Manager of Waves for Change in South Africa. And my favorite sport is synchronized swimming.
Hi everyone, my name is Shamaine Nyakonda. I'm based in Bulawayo, Zimbabwe, and I work for Grassroot Soccer, a US-based adolescent health organization, as a mental health specialist with a background in neuroscience. And my favorite sport to actually participate in is dancing, but I'm very much an EPL Premier League fanatic.
Hey everybody, my name is Megan. I am part of the team at the Center for Healing and Justice Through Sport. I was a longtime player and am a deep lover of women's soccer, although right now I am embarrassingly suffering from a walking injury. So not a lot of soccer when you can barely manage to walk.
Hi everyone, I'm Heather. I'm currently in Cardiff in Wales. I work for the Mental Health Foundation and lead the sport and physical activity space. And I've also just completed my research at St Mary's Twickenham about the lived experience of mental health at Rugby World Cups. And for me, it's getting to the gym in the morning, but with someone shouting at me and telling me what to do. That's how I get the most out of it.
Hi everyone, my name is Franck Bellivier. Presently I'm the Minister Delegate for Mental Health and Psychiatry at the Ministry of Health in France, in charge of the French roadmap for mental health and psychiatry. So at the moment, with a lot of interaction with the preparation of the Olympic Games. And my favorite sport is sailing.
I love that. Thank you all so much for sharing. I realize I didn't share. My favorite sport is running and anything through Peloton, if we can consider that a sport. But again, just thank you all so much. And I should add as well that Lululemon is so proud to be supporting the incredible work of United for Global Mental Health, and specifically the work of this Action Network. So thank you all for everything that you are getting up to, transforming your communities through sport and mental health. So Sofiane, let's start with you, if we may. How is your mental health portfolio creating opportunities for system change through sport? And how are you using sport to empower young people and partners globally?
Thank you so much, Anna, for asking. And before we start speaking about the details of the question, I'd like to share with everyone that at the Zurich Foundation, our strategic approach to youth mental well-being unfolds mainly in the prevention and promotion spaces, which we consider being the greatest form of protection. This being said, those programs can take place via sport, in education settings, or through digital means. But all those programs share in common a same vision and ambition for stigma reduction, anxiety management, and most importantly, about empowering young people to speak up about how they feel. From this general perspective, if we rewind a bit the path of the logics, a given sport environment can then become a key catalyst for changing systems. This means that a sport at our end is considered as a system. It can be through the level of a sport clubs or at the scale of a sport federation. And then this given sport environment becomes an intentionally designed catalyst to promote youth mental well-being from within and also to reach the whole society. At the end of the day, while young people might be the direct impacted individuals, by extension, they also meant to inspire peers, caregivers, and their communities as a whole. So, in practice, with our partners, we design programs in countries where I'd say sport is an essential cementing element in society. And I can refer to rugby in Ireland, for instance, but also to football in Australia. And Adam Burgess, who's also in the panel today, will speak in a minute about the Beyond Sport program called Head in the Game that leverages the universal significance of sport in the US as well. So I must say that as a Swiss citizen, I'm always amazed by how much authority certain sports in given countries have over young people throughout generations. That's why, for instance, in Ireland, with the Tackle Your Feeling Ireland program, rugby is being the catalyst to create impact for youth mental well-being. Similarly, in Australia, the Tackle Your Feeling Australia program is also leveraging the power of football to really promote youth mental well-being in life and more widely for the whole country. Just a minute about those two programs specifically. First of all, the Ireland program called Tackle Your Feeling, as I said, has been designed initially as a campaign programs, which means that key Ireland rugby players who are very well known by young people, we speak up about how they feel. This means that they become ambassadors and role models for young people to really speak up about emotions and feelings. This means that if someone who's very much followed for their physical performance, who suddenly opens up about how they feel on the pitch and in life, can certainly inspire a whole generation of young people to follow the same pathway. Interestingly, after almost 5 years of existence, or even more, 6 years of existence now, the Tackle Your Feeling program is opening up to schools, which means it will become a dual sport and school programs with the same philosophy and approach that sports power can be leveraged further. In Australia, the history of the program is also about sport, but entering through another entry point. It's where Australian football clubs, through their coaches, who are trained by a local psychologist, become the entry point to really train and promote young people to the mental well-being concept that we care about. It means that young people are then trained about the importance of mental health and mental well-being to play the sport and perform. By extension, also, they focus and care about the importance of mental health for their peers, caregivers, and communities. And therefore, the sport clubs become sort of, the core of the approach, but by extension can change the system much more widely. Now, this being said, the Tackle Your Feeling Australia programs also has an ambassador component where coaches and players also speak about how they feel and are meant also to inspire people who are not football players. This being said, I'm going to try now in a few seconds to pull threads back together. After years having piloted and scaled up those sport-based approaches in the US, in Australia, in Ireland, and beyond, we have enough evidence to see how much power a given sport can have for their young people at country and community level to reduce stigma and challenge stereotypes. And if there was only one call to action to share with everyone today, I'd say that it's about considering the untapped potential for sport to actually promote youth mental well-being and make sure that everyone has got a role to play, individually and collectively. We are all engaged in sport, as we heard, and we might also have a role to play in our given clubs. Doesn't take to be, involved in a countrywide system to really be interested in creating impact. But all in all, sport at all of those scales can actually be a catalyst for us to create a new generation of people who are aware of mental well-being further. So if anyone has got questions or interests about the replicability and scalability of these programs, I will be more than happy to pursue this discussion further. Anna, back to you.
Sofiane, thank you so much. And I really appreciate what you shared about sport being a cementing element in society. I think that's really powerful framing for all of us. I also hope that together, while this potential is absolutely untapped, we will all together be able to tap that potential of sports and mental health, especially for our young people. So if I may, Adam, Sofiane introduced your Head in the Game program. We would love to hear more about how you've developed that program and how you work using sport around the world to promote social change.
Thank you very much. Yes, thanks, Sofiane, for the introduction to the Head in the Game program. So just a little bit of background, firstly, on your second question regarding Beyond Sport and our work globally. So Beyond Sport invests in organizations, programs, and networks using sport to positively impact communities globally. We do this in three ways: delivering impactful programs by funding community-based organizations and providing capacity building. Number two, we build connections, so creating and delivering issue-led events that inspire new ideas and offer thought leadership. And number three, we amplify sport being used with intention, using engaging storytelling, elevating our global network, and illustrating the power of sport. So my focus for today, to answer your second question on Head in the Game and that program, obviously there's so many experts on this webinar in so many areas of mental health and sport. And so I wanted to focus my time on the design and delivery of the Head in the Game program, as I feel like that's potentially the most accessible and interesting way for everyone who's on this webinar to kind of take away key points. First and foremost, we identified the need and the opportunity for the Head in the Game program and for the context that we were delivering in. And we feel like this is vital when you're thinking about engaging with influential stakeholders, whether that's governments, corporations, media, academic institutions. Being able to really clearly identify the need and the opportunity in your context is vital. And so the first stage of that was in collaboration with our network of organizations who use sport for social change. We undertook a research project into the need for a program such as Head in the Game with a specific focus on the United States. So that research included looking into the current state of the mental health in the United States, consulting with key stakeholders working in that area, getting a sense for what participants on the ground are saying, and analysing gaps in the market. This research showed that minorities in the US were most at risk of being affected by mental health issues, and that while mental health discussions were frequent in elite sport, there was limited community-based programs addressing mental well-being through sport. The research also highlighted the potential for athlete activism in the United States to amplify this message, which is becoming more and more prevalent. So following this research, having identified that need and the opportunity for sport in this space, we then went into a period of programmatic design with the Zurich Foundation and Sofiane and other partners. And this program design stage involved really detailing out what a strategic, sustainable program, which through sport would address youth mental well-being in the United States, would look like. I don't need to tell anyone this phase took a few iterations. There was various back and forth and design discussions. But using the research that we built out, we were able to identify sort of priority program objectives, key audiences, such as 13 to 19-year-old young people, and demographics, which the Head in the Game program should focus on. Those ended up being LGBTQ+, and Black, Indigenous, and people of color demographics in particular, based on that research. During this program design phase, we also developed the program activities, timelines, and budgets, which would help to guide the delivery. This process led to a focus in a few areas: grant making to community-based organizations in 4 specific states in the United States, coach education of local leadership, including working with Megan and the CHJS team, who will be speaking in just a little bit, and an advocacy campaign using US professional sports and social media. To sort of share where we're at now, the Head in the Game program is actually approaching being 1 year old on May the 4th. From our initial announcement, I can tell you the research and the design took a couple of years before that. But that's seen some really positive success in terms of creating a network of sports-based organizations who address mental health in the United States, providing a significant amount of grant funding to them, and educating coaches. It's also seen support from the US major leagues, as well as some teams and athletes. And so we're really excited about the next 2 years and beyond, and confident about the impact on youth mental well-being through Head in the Game and all the amazing partners and collaborations that's created. Just to kind of circle back, from our perspective, it's often easy to overlook like the time and the money that's required to justify the importance of using sport to address mental well-being. But really, to ensure the need and opportunity go hand in hand effectively, using data, research, and community-led insight is crucial to the design and delivery of suitable and sustainable programming. So just wanted to really highlight that to answer that question.
Great. Thank you so much, Adam, and congratulations on an amazing first year. I think this combination of direct service and advocacy and activism is so powerful. And I know we're all just so excited about the road ahead for this work. Haley, if I could turn to you now, and would you please share with us how you are supporting coaches who use group-based activities like surfing to tackle toxic stress, and how are you training them to intervene effectively when working with young people?
Thank you so much for your question, Anne. I'm going to answer this question in 3 parts. So imagine riding on a roller coaster while trying to read a book. That's what it's like for children in South Africa trying to concentrate in class. It's just something that they can't do. So toxic stress occurs when a child experiences adverse childhood events, such as physical and emotional abuse, neglect, household dysfunction, witnessing shootings and stabbings, and something like walking past a dead body on the way to school becomes a norm for them. Toxic stress leaves them living in high alert, in a constant state of fight, flight, and freeze. And without the support of a caring adult or caring relationships to buffer the effects of toxic stress, it can damage the architecture of the brain. So toxic stress damages the parts of the brain responsible for emotional regulation and decision-making, which influences the way that children learn and behave. So 90% of the world's adolescent population, which is about 1.2 billion adolescents, live in low to middle income countries. So cycles of poverty and violence across low to middle income countries make toxic stress a global pandemic. It's a global priority to find cost-effective, scalable ways to getting support for children experiencing toxic stress early before mental health conditions become established, as majority of mental health conditions occur prior to the age of 14 years old. Our programs are specifically designed to prevent the onset of mental health conditions, to then get children to be able to feel mentally healthy, and as well as being able to self-regulate and self-soothe. So how does this impact South Africa as well as low to middle income countries? How does it affect the adolescents living in these countries? So within South Africa, 1 in 10 children receive mental health services. And then within South Africa as well as low to middle income countries, there's no intervention. If there is no intervention to support children experiencing toxic stress, children become dysregulated and distressed, which makes them vulnerable to dropping out of school, joining a gang, or trying substances to try and regulate themselves. So the type of training that we provide to try and provide sport-based mental health programs to organizations within South Africa as well as around the world is that Over the last 12 years, Waves for Change has developed an award-winning surf therapy program, which employs about 43 coaches between the ages of 18 and 25 years old, who reach around 2,500 participants annually within South Africa. We take referrals from partners such as schools, social workers, clinics, child and youth care centers, and many other organizations. In South Africa and other low to middle income countries, there's a deficit of mental health care professionals. There's one psychologist for every 100,000, and there's one psychiatrist for every 300,000. These highly skilled mental health care professionals are only provided to the top of our mental health care service delivery pyramid. But this is only made available to people who can afford it, and people that cannot afford it are put on waiting lists, which last for about years before they receive any type of treatment. So moving on to the type of training that we do at Waves for Change, we train our coaches in our Take 5 program. Take 5 refers to the 5 key steps and which are embedded in the 5 key protective factors, and it's something we call our 5 pillars, which is our safe space, a caring mentor, a fun activity, coping skills and self-regulation skills, and a connection to other support structures of effective sport, play, and recreation-based programming. These 5 protective factors are embedded by our surf coaches using our coaching routines, which our sessions start off with an energizer, which invites kids and gets them excited for the program. And then we move on to a check-in to see how they're feeling. And then thereafter, we move on to a Take 5 breathing activity, which is support self-regulation. And then we do our play sport-based recreation. And then after that part of the session, which is the physical-based activity, we then check out. We also teach our coaches to master essential empathic coaching skills such as praise and listening, where we celebrate progress and not performance. Finally, our Take 5 program optimizes sport, play, and environment, and we now offer the program to different organizations across the world. Surfing and other sport, play, recreation-based programs provide a great solution for early intervention or prevention services. Using sport and play as a framework makes these programs attractive to children. Just like Waves for Change, children are excited to get on the board, put on a wetsuit, and ride a wave. These programs are easy to adapt for language and culture and are a great way of introducing the vital protective factors that I mentioned earlier to children who are distressed and dysregulated before it escalates to them getting a mental health condition. And then lastly, all these the program that I just described now is scaled to our different partners across the world, in obviously around South Africa and then Somalia and South Sudan and beyond. In conclusion, I'd like to say that in order to grow the number of sport play based recreation programs available in low to middle income countries, Waves for Change now takes the Take 5 program training and support to train partners around the world, such as UNICEF, who are using the approach to grow the workforce of empathic coaches deployed across a range of sport and play-based programs across South Africa, Somalia, and South Sudan. Thank you, Anne.
Haley, thank you so much. It's such a remarkable program, and I really appreciate learning both about it and also how you are, how the program is being interpreted and activated in other countries and at scale. It's so exciting. Megan, if we may turn to you now, we'd love to hear about how you work with coaches and sports clubs to improve the mental health of young people facing inequalities.
Yeah, absolutely. Thanks, Anne. And thanks everybody for having me. I absolutely will shout out our work with Beyond Sport and the ability we have through that program to reach coaches around the country, 4 states here in the US. And I guess maybe this is sort of where I'll share what that actually looks like, what it looks like to help coaches understand what they can do, the unique power they have to help young people heal from the impact of overwhelming stress and trauma. I think Haley did such a great job of sharing what Waves for Change does, and it's sort of a nice springboard to share exactly what we focus on, built on neuroscience and our partnership with Dr. Bruce Perry and the Neurosequential Network. We've built a model that really focuses on three things that help young people who have been dysregulated or distressed sort of re-regulate, change their brains back. One of the most beautiful things I think about this work is, yes, the brain can be impacted by trauma, but it can equally be impacted by positive experience. And so because the brain is plastic and use dependent, because it can always change, and the parts that you use the most are become the strongest, we can heal from that negative impact. And so what we know about healing is that three things that sport combined are uniquely powerful. So lots of interventions do a lot of wonderful things to impact the impact of stress, but sport combines three things uniquely in a way that I think is profoundly powerful. The first is the power of relationships. Trust is the antidote to stress. And so whereas stress dysregulates us and causes us to sort of always be on guard, the presence of a trusted adult in particular, someone who we believe will help keep us safe, allows a young person to let their guard down in a way that allows them to fully engage with what they're doing. Right? When we have our guard up, it's so much harder to engage in learning. It's harder to engage in any kind of proactive activity because we are constantly scanning for threat. A trusted adult allows us to sort of settle into what we're doing, to be more open to learning, to actually allow our brain to open up to the possibility of what we're doing. So helping coaches understand and prioritize the power of their role as a trusted adult. What can they do to create the safest spaces possible for young people? What can they do to make sure that young people really genuinely believe that they are safe and can rely on that coach? Things like making sure that they're as predictable as possible, right? Some of our sometimes coaches are as unpredictable as the games they play. And we want to make sure that coaches understand how impactful it is when a young person knows what to expect from their sport experience. So those positive relationships are critical. The second thing is that we have to move our bodies. Sport is, trauma is deeply embodied. Trauma lives in the body, not just in our brains. And in order to affect change in something that's embodied, we have to use our bodies. We need an embodied intervention. And so moving our bodies, sport helps us actually, release the right chemicals, the right neurobiological chemicals into our brain, which is great. And I'm going to tell you sort of how that happens. And when I say this, it often sounds like I'm saying 1 + 1 = a bushel of apples. But part of what's happening with the chemicals in your brain is that when we move our bodies, we mimic the sound of our heartbeat. And in our brains, we're actually mimicking the sound of our mother's heartbeat, which is at the very, very foundational level of your brain, way, 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 way back down when your brain was first developing. There's a very strong association made between the sound of your mother's heartbeat and having all of your needs met, being fully regulated, being safe, being warm, being fed, having everything that you need. And every time we engage in that patterned, repetitive, rhythmic sound or motion or activity, we're calling back to that feeling of safety. So in the same way that a trusted adult can help young people feel safe, moving our bodies actually also makes us feel safe and allows us to feel regulated and, again, let down that guard, be more engaged. So sports combining those beautiful relationships with the opportunity to move our bodies. And the third thing is the idea of having the right kind of challenge. We find that with when with folks who work with young people, particularly young people who have been affected by overwhelming stress or trauma, we all have this instinct to want to protect them, to sort of wrap them up in bubble wrap and hope nothing bad ever happens to them again. And while that might keep them from further harm, it actually won't help them heal, because the opposite of overwhelming stress is not no stress. It's the right dose of stress, because we're sort of building those patterns again. So what happens when you experience overwhelming stress or trauma is that your brain reacts in the biggest way possible and sort of stays up here and has the hardest time coming back down from that change, right? So instead of having a little bit of stress and being able to recover, and having a little bit more stress and being able to recover, we end up here. But in sport, all these skill building activities, all these things that we do to move our bodies, we're stressing a little bit and we have the chance to recover, and a little bit more and the chance to recover. And we're rebuilding those patterns, which is really the building of resilience. Stress that is overwhelming, prolonged, or extreme, it makes us vulnerable, but stress that's controlled, moderate, and predictable actually helps us build resilience. And so we find that when coaches understand this, like in the Head in the Game program, or like in some of the work we've done with the Olympic Refuge Foundation to release some guidance on working with young people who've been forcibly displaced, or in any of the work that we're doing across the US, when coaches understand the power of those things, they can use them in an intentional way.
Amazing. Megan, thank you so much. That's such a powerful articulation. I'm really also struck by what you shared about the importance of relationships, clearly with coaches, but also just the relationships that young people are able to make through sport that are based in trust and so unique. And as you articulated so beautifully, just such a powerful piece of how we can advance and support their mental health. Thank you. So Charmaine, if we can now go to you, we would love to hear about how you are effectively engaging young people and adolescents through your Mind Skills program at Grassroot Soccer, and supporting young people to increase mental health knowledge and access high quality health services through your programs.
Thank you very much for the question, Anne. I think the best way to answer that question is to first take a step back to provide some context of our work as an organization. So Grassroots Soccer is an adolescent health organization that leverages this power of football and the metaphorical hook of soccer knowledge and soccer terms and soccer activities to really relay information and skills and knowledge to young people and adolescents for access to health services and health information. We were originally founded in 2002 and mainly focused on HIV and then SRHR. But in 2022, that's when we launched our mental health strategy and actively started working in mental health. And one of the key things from the previous work that we've been doing that we then continue to do was that since 2002, we've actually reached 25 million adolescents. And we really took that opportunity every year when we were building that number of reach to learn the different key ingredients that are necessary and that are key to engaging adolescents, given that our program's target population is adolescents, where our Mind Skills curriculum, which is our mental health, our promotion of positive mental health program that's 100% focused on mental health, really targets the age range of 10 to 19, where the program is really optimized for 10 to 15. And given that was our age group, we continued on to really build on this idea of leveraging this power of soccer and metaphors around football/soccer, depending on which country you're in, to relay this information and knowledge and skills on information around health and healthy behaviors and access to services to young people. So how have we been effectively engaging young people through Mind Skills, our promotion of positive mental health program that's a 12 practice session, which averages about 15 to 20 hours in total. So the best way to answer that, given the background of the work that we've been doing and our reach is to really take you through our model. So our model is based on the 3 C's, which are curriculum, culture, and coaches. So under curriculum, GRS really ensures that our curriculum is activity-based to make sure that it is fun and is engaging and has this experiential learning for adolescents. So instead of sitting adolescents down and teaching them about balancing stress and stresses in life, what we do in our curriculum is bring in those hooks and metaphors around football, around soccer, where we actually have in one of the practices, participants get a one big football and it has a sticker on it written healthy mind, and they get to throw the ball at each other and balance the ball in the air without it falling. And then we ask participants what stresses them. And then we take tennis balls and we write those different stresses, and then we place them on those tennis balls. And then those participants then continue throwing the healthy mind ball. And then the coach who's delivering the program, the near peer coach who's delivering the program, then actually starts to throw in some of these tennis balls that represent different stresses, like exams, like needing money to buy something, like a relationship. And then the group that is participating needs to balance that healthy mind ball in the air while juggling the other balls that are coming in. And then after that activity is done, then the curriculum then takes the participant through the process of thinking about trying to manage a healthy mind, and then thinking about, okay, all of these other things that keep coming, you can't throw them out. You can't just take them and ignore them. You have to find a way to balance that and then bring in that conversation around stress. So really, one of the key things in making sure we are engaging young people effectively is how our curriculum is designed in this activity-based approach, where we're really making sure that young people are getting those fun moments. And then another thing as well in our curriculum is we're really intentional about ensuring that we are providing accurate scientific information around mental health while making sure that the information is as simple and contextually applicable as possible. For example, in South Africa, a young person, when they're going through depression and they've been going through the worst time for 2 weeks, is not likely to bring it up in conversation and say, I've been feeling depressed. They're more likely to be with their friends and saying, Yagoa, which is really a slang term that means I'm going through the most. And so young people already have this language around mental health and these different phrases that they use amongst each other to speak about mental health. And we really make sure that we're tapping into those phrases and those languages and bringing them out into the curriculum to make sure that we're using phrasing and we're teaching ideas and skills that they can actually translate in their minds and retain. And then the second C in our model really is culture. So we make sure that our culture is fun. As I said, a lot of our practices will have footballs, we'll have pressure limbo, we'll have a lot of familiar activities that have a metaphorical lesson around mental health and some links that soccer brings into that in them. And we bring out the fun in that. But the other fun in that as well is that young people get moments to do what they call kilos, where they sing and they celebrate and they also praise each other. And it's this environment of fun to ensure that they are learning in an environment where they feel engaged. But another key aspect of that culture of fun is that young people get to contribute towards the kilos. A participant can say, actually, I prefer to use this word, or can we actually dance in that kilo instead of describing a movement? Can we actually run around? Can I show you something with this football that we were using for juggling my life that we could apply in the kilo? So there's also that active, meaningful youth engagement that then comes with this culture of fun that our model is really focused on and emphasizes. And then the last part really of our model is our coaches, who are the near peers that deliver this program. And they live in these communities that the young people come from. And the coaches undergo training and continuous support to learn how to be a role model, to ensure that the young people are actually able to build these strong support networks. I think one of the key lessons we've been getting from young people on our model, especially on the value of these coaches who deliver the program, is a lot of young people approaching their coaches and saying, I actually experienced a trauma last month and I was thinking I was fine, but I got to speak to you and I actually realized I wasn't fine, but I was actually happy that I could speak to another young person from my community who actually understands what I'm going through. And that actually is what led that participant to then accessing higher levels of care through referral, because the very presence of that coach who was just ready to say, how are you today? Let's do a practice and let's speak, allowed that participant to accept first that they needed to access services and to actually express that they needed those services and then to be referred to them. So really our model is really focused on making sure that we can deliver on our mental health solution that focuses on helping adolescents build a resilient mind, helping adolescents maintain a healthy body to fuel that healthy mind, but also helping them to build those strong connections. Because, when you're 12 years old, you can tell your parent or your teacher that you're stressed and you are not functioning as well as you want to, but you will not usually feel as understood as you would a near peer that you can say the same thing to, and it's only been 3 years since they last experienced that experience. So really, our coaches are really a core aspect of our model, and our model really focuses on engaging young people as well, from program design to implementation to evaluation to during the implementation, just to make sure that we're speaking their language and we're giving them the information that they need, but we're also using the type of environmental cues like leveraging football to make sure that they understand the information that they need to really build this resilient mind and maintain a healthy body. Thank you.
Oh, Charmaine, thank you so much. I really appreciate bringing fun into this conversation. It is inherent in all of the work that's being described, and yet it is something that is so special and unique to the experience of sports and the arts and these experiences, Sophie, as you introduced, that are really, we hope, cemented within our societies. And I am definitely bringing that healthy mind ball exercise to my family and my community. So Charmaine, thank you for that. Heather, if we can now please go to you. We would love to learn about your research in the lived experience of mental health in a Rugby World Cup context.
Thank you so much. Well, like everybody else that you've heard from so far, I really value people and want to advocate for them. And that is why I got into research. It certainly wasn't because I wanted to learn the Harvard referencing system, which drove me wild when I was doing it. But like everyone else, the kind of golden thread through the research that really emerged was that actually it's all about valuing people. And so for me in my work with Mental Health Foundation, when I'm working with young people, perhaps on a 3G floodlit pitch at night in London, in inner city, I'm trying to help them to understand a little bit more in a fun way about mental health and what they can do to support it. Or whether it's talking to a Rugby World Cup athlete who's a mega star all across the world, it actually all comes back to the same thing about creating a safe space for them to be who they are, and also comes back to relationship. And so I saw a quote today actually from Leah Wilkinson, who's an England football player, and she was saying that for them, it's completely different with their fan base because they can be their authentic self. And we know from the research that we've looked into at the Mental Health Foundation as well, and it's common sense really, isn't it? But actually having autonomy is a basic human need, and it's a protective factor for mental health. And so my research was into the lived experience of mental health for rugby players and backroom staff. So that could be physios or medics in a Rugby World Cup context. I was able to carry out interviews, qualitative studies from players and backroom staff from 10 countries, some who had made a Rugby World Cup and some who I had the privilege of speaking to who had been dropped. They didn't make the competition or they'd been injured. And that felt like such a privilege to listen to every single one of their stories. And so for me, I want to take this research and I want to honor the voices of those who spoke to me, and so that I can pass that lived experience on to others. I know some things about well-being and mental health in sport, but I played one game of rugby. It did not go well, and that is me done. And so actually sharing that lived experience of those players and backroom staff is what's going to go on to make a difference, and that authenticity that they can pass on. In my research, I came across this quote, which says this, that the lived experience and perspective of athletes are often unheard in research and practice in relation to athlete development. And this is ironic, given that they are the main subject of development and they have the lived experience, which makes them a truly qualified knowledge expert. And so it's so important that the voices, whether it's the young people that we're working with in our communities, or in this context, elite athletes and their backroom staff, that those voices are really, really heard. And so what emerged for me and from the data, my themes were around getting the right support and the importance of lived experience in that, and then powerlessness because of the pressure to perform, and also a lack of autonomy that was felt through the research. And people, some of the athletes I spoke to had wonderful stories of supportive coaches that made all the difference to them. And then also just terrible, awful stories about the environments that they were in that Megan kind of alluded to earlier, with the power of the coach. And something that really stood out to me from my research was this power of lived experience. And one of the players said, you could be the best sports psychologist in the whole world, but if you've not played rugby at a Rugby World Cup and understand my culture, I'm just not going to listen to you. And so there's a place for various kinds of support, and the evidence showed in my conversations that I had. But really what emerged was that need for a confidential and a safe space. There's a space for sports psychology, but when that comes down to performance, actually it goes back to Leah's quote of wanting to be their authentic self, back to creating a safe space and having a trusted relationship. And so for me, what does that look like going forward? Well, I want to be able to speak up for those who have no voice. And that's not the case for everyone in a Rugby World Cup context, but many elite athletes don't feel able to share their authentic voice because of various pressures. And in the same way as many of you have shared about speaking up for those who have no voice because of different circumstances, different vulnerabilities, I would like to use my resources to try and speak up for those athletes and those backroom staff. And so going forwards, there's an opportunity to try and collaborate with other people in academic spaces, with former players, with those playing now, with other organisations, to take this lived experience, to dig deeper, to do more research, but then to get those voices out there. Who better to talk to you before you go into a Rugby World Cup training camp about what you could do to prepare yourself for when you're dropped? Nothing can totally prepare you for that. But then a player that's been dropped twice for a Rugby World Cup, who better to help you to understand what it might look like post the Rugby World Cup for that come down after the games? Well, someone who's been there before. Who better to help a medic think about guarding their time so that they're not on call 24/7 and not looking after their own well-being? Someone who's fought those battles before. And so for me, going forward, I'm excited to try and to leverage more support, more resource, more lived experience, more time. I can't do this alone. And ultimately, for this lived experience to get out there, it still comes back to, guess what? Relationships, and also creating safe spaces for these voices to be heard and to impact.
Heather, thank you so much for really bringing the importance of lived experience into the space and into this discussion. I am so lit up and inspired by what all of you have shared. And I know I speak for everybody on this call with just how much I've learned. Thank you so much for that. So we're going to go into our Q&A now. And following Q&A, we'll hear from Frank on the French government's plans to promote mental health in the Olympics. I can't wait for that. But first, I'm just going to start reading out some questions from the chat. Just a reminder, audience, please put your questions in the chat. Please vote on your questions. We are hoping we'll have time for all of them. I will ask a question, and then esteemed panelists, please jump in with what you have to share and respond. I think most of them are quite general in their scope. So first off, do any of the awesome programs here, absolutely, take a trauma-informed lens in their work? If so, how does this look in program planning, adaptability, and practice? Please jump in with a response.
Okay, sorry, I did reply in the chat. Where did it jump to now? Sorry, that question jumped away. Okay, sorry. Okay, sorry, it jumped all the way to the bottom. Why does it keep jumping away every time I'm scroll?
They move when people vote, Haley. It's tricky.
Okay, sorry. We have a very clear routine and structure which supports a sense of safety. We also use things like strengths-based approaches, goal. Oh, where it disappeared again. Give me a second. I was almost done. Should have read a bit faster. I'm very sorry, guys. Okay, there's strengths-based approaches, goal setting, and then we focus on helping children building skills to cope with adversity and plan for their future. So in our program, the children come for a 10-month program in our surf therapy program, and thereafter they graduate to surf club, and then they still have access to the 5 pillars, and then they can also then plan for their future. And then it's a question below, but I'm going to repeat it again, is that the children come to surf club, and then they can also have an opportunity to then be a coach in the program once they finish school. Yeah.
Thanks. For us as well, we focus on 2 groups in terms of trauma-informed approach, where we are cognizant that our participants live in chronic stress situations and some experience trauma frequently, but our coaches also come from those same environments as well and also have those same kind of struggles as well. So on the participant side, we really focus on making sure that safety is a priority, that the participants have peer support, that they have this coach that they can speak to, and that they also have a space to have fun. Because one thing about trauma and mental health is we can focus a lot on the mental health, on the anxiety and depression, but sometimes someone just wants to have fun and feel normal again. And that's why that's something that's really important in our programming. And with our coaches as well, we've been actively working on a coach wellness program and building partnerships with other organizations to make sure that we're also caring for these carers, because some of this trauma also translates to them, and we're making sure that they're getting frequent debrief sessions with external mental health professionals, that they also do fun team building activities, that there's also like referral processes in place to make sure that everyone for whom trauma can affect has some benefits in our programming as well.
Great. I think I'll go on to the next question then. And that is, let's see, these are incredible stories of impact. How do the panelists recommend that we advocate for greater recognition of the value of sports in improving mental health in deep and profound ways? Some clinicians and donors are still underestimating what sports mean in this context.
And I can just maybe provide a nugget of information here. So from the Zurich Foundation side, I hope you are convinced that some so-called donor quotation mark have great interest in the topic. This being said as well, speaking about advocacy, it's, as I said, it's both individual and collective, and I believe the group of people we are here is showing actually the importance that is given to sport in general, in terms of how mental health can be actually a joint focus. And maybe we can also informally or even in a structured way continue the discussion together and maybe come up with certain common objectives for sport to take a better place. But I think it's in the making, and I see really core developments in the last 2 years, let's say.
Yeah.
I think as well, if we can just continue to share the evidence, so by showing there's so much evidence and research out there. And if we can just share it in compelling ways through case studies and stories, as well as statistics. I really loved what was shared with Hayley, how you started with those statistics and the impact. It is there. We just need to continue to shout about it and show it. And it's awesome, all these organizations, many of them that I know and have worked with, that you are doing that you are evaluating with really trusted partners. And it's awesome, isn't it, when you can get researchers together with programmatic people to do that well.
I would also say inviting these key stakeholders to actually participate in the program. We have a lot of strategic partnerships with government representatives and other major organizations in Kenya, Zimbabwe, etc. And they actually come and participate in a mind skills practice. And afterwards, they can't stop talking about it. And they want their kids and other kids to experience it. So once somebody actually has that lived experience of your program, it's easier for them to have that buy-in.
I would just echo what, certainly if you can go to a program as wonderful as Grassroots or Ways for Change, you should. But I would also just shout out here in the US, the Women's Sports Foundation, which is a pretty well-respected organization who does a lot of great work translating research and policy and practice, just put out a wonderful new report with qualitative and quantitative methods on the impact of sport on girls, in particular mental health, but more broadly young people's mental health. And it's so full of good stuff that it's fully highlighted. My version is fully highlighted, almost more highlighting than not highlighting in that one. So I think research like that, the translation of that research into real life practice and policy is really important as well.
Yeah, Megan, thank you so much for sharing. That's the perfect bridge to this next question, which is, and I see that you answered it already with that remarkable study, but what are the key research gaps on the effectiveness and cost effectiveness of sports for mental health, specifically in low middle income countries?
I think the cost effectiveness question is not very well answered. So I think there's a lot of gaps, a lot of huge research gaps there. I think maybe it was Hayley talking about the number of clinical professionals to the number of folks in their country. I think there's a huge need for a better understanding of how sport can sort of help democratize mental health work, and not just as sort of mini therapists, which I think sometimes the clinical world is trying to make sport, because young people show up for sport, we're trying to train the adults to be mini therapists, when in fact, actually, there's so much about sport that you can leverage to help promote positive mental health that doesn't actually take them away from that and is maybe a more realistic task for coaches than to be full clinical interventionalists. But I think there's a ton of work that needs to be done to really understand what that means from a cost perspective and from an outcomes perspective. We don't do a lot of really good work understanding the impact of preventative work, but also the role of sport as an intervention for young people who've been impacted in particular by trauma, and what the healing potential of that can be.
Amazing. And sorry, I got a little lost in this chat as well. Divya, with apologies, the highly voted on questions have disappeared. So I'm going to go into one. I'm just going to take the question that's at the top. So it's without a doubt that sport has a profound effect on mental health. But how do you fill the void when you get older or have an injury that prevents you playing your preferred sport? Can relate. I played football in the UK since age 7. Now at the age of 46, my knees have given up, which has impacted my physical and mental health. What can I do?
I'm happy to jump in if helpful. Just from my work with national governing bodies here in the UK, there's so many different adapted sports now that are available. I don't know how your knees are doing, whether there's walking football or walking netball and all of those different kinds of sport. But some research we did with the RFU, so the English Rugby Football Union, we talked about that, about volunteering and coaching and being on committees and seeing if there's a way to support good mental health by being involved in the organization and through another role as well. So maybe those adapted sports and then which are super competitive and then also perhaps just a different role to be involved in the sport and it being good for your mental health space.
Amazing. Thank you, Heather. I think this is going to need to be our last question, but I know that there is already follow-up and will continue to be follow-up on those questions that we weren't able to get to in the chat. There's a lot of exclusion and trauma going on for transgender, non-binary youth in and around sport in the moment in many places, and specifically naming the US, which creates some very specific barriers to joining sport or trusting anyone inviting you into sport. Are any of you working with trans, non-binary youth, and how are you approaching this?
I answered this in the question or in the chat too. We have a specific training module that we use to help upskill coaches who are looking to do a better job of including LGBTQ and trans, gender fluid, non-binary young people. Part of the challenge in the US inherent in this question is that the people who are interested in that are maybe not the people who need it the most. The people who are interested in making sure that sport is more inclusive tend to be the people who are already doing a pretty good job, but certainly can get better. We have a unique partnership with the Seattle Kraken, which is the hockey team in Seattle, who have taken that issue as something that's particularly important to their community. The other program that I'll call out is a wonderful program in Los Angeles called Rainbow Labs. And part of what Rainbow Labs is doing is creating all queer sport teams for young people and making sure that there's great representation from the coaches and leadership of the organization so that young people feel can see themselves in the folks who are part of the decision-making of the organization. They are navigating whether or not to participate in sort of mainstream sports or create sport opportunities that are separate, and have tried and are doing sort of simultaneously both for young people who are more interested in sort of being on a queer team in a mainstream league or being on a queer team in a queer league. So I think some people are trying to be really intentional and thoughtful about it, and I hope that continues.
Megan, thank you. And thank you all for these terrific questions and answers. And I know that this conversation will continue post on Circle. But Frank, let's go over to you now. I know I can't wait to hear, and I'm sure the audience as well, about the French government's plans to promote mental health during the Paris Olympic and Paralympic Games.
Thank you, Anne. And after this beautiful presentation, I'm very happy to share with you our plans for mental health at the Olympic Games in France. So, first of all, the International Olympic Committee is committed to supporting the themes of sport and health at the Olympic Games. And actually, in France, this is what we call the major cause for 2024. And within this theme, there is a specific component on sport and mental health. And in this component, there are several aspects to this. First, the International Olympic Committee is first and foremost involved in preventive actions. And the committee has stressed the importance of preserving athletes' mental health and has set up programs to help them recognize and deal with mental health problems. For example, athletes have access to a helpline called Mentally Fit, which offers specialized short-term care, practical support, and referral to appropriate committee reporting mechanism in the event of suffering that may result in particular from harassment or abuse. In addition, there will be a specific area within the village dedicated to mental health well-being, which is located just above the fitness room and accessible to all. And one or two welfare officers will be stationed in this area. And on Paris 2024 side, we will have also clinical psychologists at the polyclinic who will be available into this space and will be in contact with a psychiatrist in if necessary. The second component is conferences open to the general public organized by Club France. And actually, the French ministry is involved in this, also in this piece. And at the Ministry of Health, we are currently working on conference projects to promote health-related themes. To say shortly, it's related to link between physical activity and sports, health and mental health. And so these conferences will take place during the Olympic Games, focusing and they will focus on the link between physical activity and sport and mental health. These conferences aim to promote regular physical activity as a factor in preventing or even reducing symptoms of certain mental health disorder. The conference are also intended to contribute to the destigmatization of mental health disorder, and we strongly believe that the period of the Olympics and Paralympics is the very moment to conduct destigmatization activities, and also to talk about mental health problem caused by high performance sport. The key message here would be conveyed by public figures, sport personalities and champions, and mental health professionals. And the messages will be adapted for an audience made up of also health professionals and intermediaries in the fields of physical activities and or mental health. We anticipate the participation of WHO representative for some of these conferences. The third component is in the context of the mental health first aid program that is actually enjoying strong growth in France in a wide range of sectors: students, schools, business world, social workers, etc. So it's really a very successful program in France these years. And the promoter of the mental health first aid program, together with Nightline, I'm sure all of you knows about this association who conduct very, very important activities also in France. So this group, the promoter of the mental health first aid program, together with Nightline, are preparing videos with sport champions, and we have already identified many important champions who accept to talk about mental health, either regarding the problem they had to face at one stage, or on the importance of having a good mental health to achieve performance, and how looking for performance may affect mental health. So these videos will be broadcast by the Ministry of Health and the Ministry of Health Institutional Communication Department will be responsible for that. After the Olympics and the Paralympics, we have a rendezvous every year in October called Mental Health Information Week that will take place in October. And the theme, of course, this day is on the move for our mental health. And this will continue, will strengthen the mobilization on sports and mental health during the Olympic Games. Just to remind, this is a very important event all around the French territories, because so far more than 1,500 events are planned for October 2024 all over France in a large variety of formats. That's where we stand so far. We are a bit more than 2 months ahead of the Olympics and more than 4 months ahead of the Paralympic Games, and more actions are being prepared. But actually, that's where we stand at the moment.
Oh. Frank, thank you so much for sharing. It's really going to be an astounding moment for the recognition of the very strong ties between sport and mental health. I can't wait for October. So we are going to end this so rapidly. If I could ask all of the panelists to give as sweet length a conclusion to this sentence as possible. For greater recognition of the connection between physical and mental health, we must. And we're going to go in reverse speaking order. So let's start with Heather, then Megan, then Charmaine.
We must advocate for the voice of lived experience to be heard, valued, and shared.
That's so much better than mine. Can I just co-sign Heather? No, I was going to say we must keep shouting it from the rooftops.
We must advocate for the prioritization of adolescent mental health promotion and prevention.
Yes, amazing. And then Haley, Adam, Sofiane, and Frank.
We must not work in silos. We have to work together for the greater good. Something at Waves for Change that we always say, Simunye Sisonke, together as one.
We must, similar to others, we must listen to our participants, build the case for urgent support, and communicate that need with decision makers clearly and concisely.
We must always contextualize the universality of sports.
Well, we should create a club of ambassadors with lived experience, sports champions, but also people with lived experience in mental health problems.
Amazing. And I'll just add that we must keep having this conversation. Thank you, all panelists. Thank you, everyone, for being here. This conversation will continue on Circle. The link to join will be in the chat. And the next webinar will be on June 11th and is on allyship and social participation. The link to register is also in the chat. Deep thank you for all of the wisdom that has been shared with such generosity today. I hope you all have wonderful days and evenings. Thank you so much and be well.
Thank you.
Thank you.